you three main things. First of all, I'm hoping to cover the identification of the essential elements of SBIRT. Secondly, talking a little bit about what some of the screening tools for SBIRT are, not just for alcohol and drug use, but also for mental health and gambling. And thirdly, I'm going to focus on some innovative ways of delivering SBIRT on a college campus, no matter what profession you may be in, whether you work in a counseling center or whether you're a health promotion specialist. There are many different professions that do SBIRT, and in fact, even peers can deliver SBIRT when well supervised. So we will be talking about that. So let's start from the beginning and talk about what SBIRT is. SBIRT, or Screening, Brief Intervention, and Referral to Treatment, is a conversation. It is a brief conversation in large part. Sometimes as brief as only a few minutes, and sometimes maybe as long as an hour or a couple of sessions. And it is done using what's called motivational interviewing, which I'm sure most of you are aware of, but we'll go through MI briefly today as well. And we're also, oh, what happened here? We're also going to be talking about the fact that SBIRT is evidence-based. It has a lot of research behind it, and it works very well. So SBIRT is really something that one can use, and you can help your students reduce their alcohol and drug use, support their mental health, address their gambling, and address a variety of different other areas. Okay, so here we have a slide showing some of the purposes of SBIRT. So SBIRT helps us identify some of the concerns that our students may experience. Again, alcohol and other drug use, mental health concerns, and even risk for suicide, gambling, and there are also screening tools to address other issues that students may face. And they can be delivered through SBIRT in the same way as I'm going to show you today. Secondly, SBIRT helps students identify resources that they can go to should they need some support and assistance with the issues that are identified as concerns through the screening. And then thirdly, what SBIRT does is it prevents consequences of alcohol and drug use, mental health concerns, and related issues by identifying issues early and often before issues or concerns may even start. Okay, so again, SBIRT has three components. It has a screening phase where brief screening tools are administered to students. Second is a brief intervention, that is a face-to-face or virtual contact, or sometimes even just online contact with students, receiving a conversation through motivational interviewing. And then the last piece, and this is only for some students, not all, and actually relatively few, and that is referral to treatment. Probably less than 20% of your students will need immediate referral to treatment, but it's good to identify those students so that they can get assistance and support very quickly. All right, so conversations can be life-changing for our students, and conversations as well can help make a big difference for our students. Many times we have an inclination as professionals to tell students what to do and to serve as the experts and advise students regarding what they should do next. But this is truly a conversation where you and your student go back and forth as partners to see what is best and identify what is best for the student. Okay, so with each conversation, we are moving forward with our students. We are essentially planting seeds and helping seeds to flourish. So it may well be, for example, when you deliver an SBIRT intervention for your students, the students may say, okay, thanks for the information, but I don't really want to do anything with this right now. So they walk away from you and you think, oh, what did I do here? I didn't do anything to help this student. But in fact, you did, because maybe 6 weeks later, 3 months later, even a year or two later, the student may remember the conversation with you that you had with them with the SBIRT intervention, and they may be ready at that point to take the next step to support their health and their well-being. So you are planting a seed every single time you deliver an SBIRT intervention. Okay, why do we want to do SBIRT interventions? Why ask, for example, about alcohol use? We'll just focus on that for the moment. Because alcohol use is a very common issue, as we know, among college and university students. If we look at other drug use, like cannabis use, for example, that's also now fairly common with increasing legalization across different states. Gambling is also in the increase. It's something to look out for and to do SBIRT for, and also mental health concerns. And if we address these issues early, then we can mitigate some of the negative consequences and support the health and well-being of our students. So, what better way than to address these issues early? So, when we think about SBIRT as well, there are some barriers that we need to think about. And these are really barriers within ourselves or within individuals who may be in positions to deliver SBIRT. So there are stereotypes, very sadly. I know as a licensed psychologist, sadly, and I've written about this, that there are many psychologists, for example, who don't want to do any screening for alcohol and drug use because they say, well, if I know about it, I need to deal with it. And that's really not the best way to go. And that's really ultimately due to the stereotypes that people hold. And here are some of this data on stereotypes that people who deliver SBIRT may have and what prevents them from doing it. So, there's a percentage of professionals that think that on screening tools delivered through SBIRT that people lie. Well, probably a few people lie, but most people don't. And with delivered with the SBIRT, motivational interviewing spirit, the potential for lying or distorting information, or what I would call underreporting of risk behaviors, is reduced. Secondly, people may think that they may make the student uncomfortable if they ask about substance use or other risk behaviors. In fact, the data show that students actually appreciate being asked about these sensitive topics because they are often looking for help and looking for support and looking for somebody to talk to them about these concerns. Next, it may be that the clinician or the provider or the health promotion specialist may be uncomfortable about talking about alcohol and drug use and other risk behaviors. And so that may deter people from doing SBIRT. So it's important to know about these stereotypes, to think among yourselves or within yourself, do I have anything that is a barrier for me to delivering SBIRT, and to address that by educating yourself and looking at the data supporting SBIRT and knowing that students really do want to hear from us about these issues, and they often do want help for these concerns. Okay. So why do we want to do this? Okay. Why do we want to talk about SBIRT? Why do we want to have these conversations? Here you see some reasons that with alcohol and drug use, if we start there, there's a lot of comorbidity, that is co-occurrence of a variety of different concerns, mental health concerns, risk for suicide, risk for interpersonal violence, risk for HIV/AIDS, a whole variety of different things. And if we intervene early and address one issue, we are also helping address the others, even though we may not be addressing them directly. It's also very, very important as we work in academic institutions to know that risk, that is risk related to alcohol and substance use, gambling, mental health concerns, the whole array of issues directly correlate with academic success. Okay, so the less risk that students experience in the areas I just mentioned, the more likely they will be to academically succeed, to be retained in college, to not drop out or stop out of college, and to complete college and enter the workforce. Okay, so if you need to make a justification or an argument to your university administrators regarding the importance of SBIRT, you can clearly link it to the connection to academic success. And here's even more information that links substance use to academic success, or lack thereof. So students who experience alcohol and other drug concerns, mental health concerns, and I would also say gambling, though there's not much research out there to support this, all of these issues are related to dropping out of college, stopping out of college, and not completing college. And what is it that our administrators want? They want students to complete college. They want them to finish. They want them to stay in college. And you are making a big difference by delivering SBIRT in supporting these things. Okay, so this is just a quick review of SBIRT. It's a conversation. It's brief. It has several components: screening, brief intervention, and referral to treatment, and it's evidence-based. So let's now look at exactly how we might do this. So on this slide, you see a list of different ways that one can deliver SBIRT. Probably the most obvious way is delivery in person, and that too can be done in different settings: in a health center, in a counseling center, in a residential life setting, in a health promotion setting. A really innovative way to deliver SBIRT is to place your staff members, if you have the capacity, in academic advising settings. That's what we're doing on our campus with a new study that we're doing. So we are placing health promotion people and students who are trained in doing SBIRT in advising settings. So the advisor sees the student, does the academic advising, and then walks the student over to us and says, would you like to get a well-being assessment from one of our peer navigators? And students by and large say yes. And so, what better way to reach a lot of students with SBIRT than to place yourself in an advising setting. There are also other ways of delivering SBIRT through virtual settings and online, and anonymous screenings, which we'll talk about in a little while. All right, so as I mentioned, SBIRT has three primary components: screening, brief intervention, and referral to treatment. So here are some of the screening tools that are used typically with SBIRT and that work well with college students. These are primarily, actually, I think all of them are public domain, which means you can use them without getting any special permissions, which is also very good. You can just start quickly. So there's the audit, the alcohol use disorder identification test. That's a 10-question instrument. There's also an abbreviated three-question instrument. There's the QDIT, the cannabis use disorder identification test, which is comparable to the audit, but addresses cannabis use. There is the NIDA Assist, and that's actually can be done online or through interview. It starts with a one-question screen for alcohol, other drugs, and tobacco use. And if a person says yes to any of those, there are follow-up questions that can be asked as part of the screening. There's also a one-question screen that for alcohol use and cannabis use, which I'm happy to share with people offline. And also it's part of the NIDA Assist. You can get it there. There is there's a screening for gambling called the South Oaks Gambling Screen that works well with college students. So that can be used for gambling. And the PHQ-9, which is the Patient Health Questionnaire 9, which looks at mental health, primarily depression, and risk for suicide. So all of these are public health domain instruments. You can use them for your screenings. They really take no more than a few minutes. All right. So after you screen, okay, what you do is you look at the instrument and you look at where the person stands in terms of their total score. There are metrics to each of the instruments. You'll know who's low risk, moderate risk, and high risk, and that'll help you engage in the second part of an SBIRT intervention, and that is the brief intervention. A brief intervention primarily is brief. It is a conversation. It is short. It is as little as a few minutes or maybe 1 or 2 sessions, depending on how you do it. And you engage in a partnership, in a conversation with your student. It's very collaborative. All right, so the training in motivational interviewing can take hours or days. I'm going to try and, for those of you that are new to MI, just go over briefly what some of the key elements to MI are, and then we'll go over what's part of a brief intervention. So the spirit of MI is collaboration. What you want to do in a motivational intervention is you want to support discrepancy. Okay, so you want to look at what the client's goals and aspirations are compared to their risk behavior. You know, how is their risk behavior impacting their goals and objectives. So they want to help develop that discrepancy. What are the good things about your alcohol use? What are the not so good things, to help them look at the differences? To support self-efficacy, to empower the student. There are four elements. Also, to express empathy. You're always expressing empathy with the students and with any person you're doing MI with. An acronym that's important with MI is also RULE, and RULE stands for you want to be responsive and respectful to your person. You want to understand what they're saying. You want to listen to them, and then you want to empower them to change. Again, this is a conversation. Thirdly, you want to use four techniques in MI, and the acronym for that is OARS. Open-ended questions. Okay, you probably all know what those are. They're questions that don't require a yes/no answer, like, tell me more about that. Affirmations, supporting a client. Thank you so much for coming here today. It must have been really difficult for you to make that decision. That's an affirmation. To respond using reflections. Okay, that must have been really hard for you. There are different types of reflections. That was just one example. All right, and then lastly, supporting self-efficacy. And supporting change. So you basically put all these elements together, the open-ended questions, the affirmations, and the reflections, and you're essentially supporting self-efficacy. All right. And the goal is to elicit what we call change talk. That is something that a person says to you that will indicate that they want to make a change. Oh yeah, I never thought about that before. You know, how do I learn to reduce my drinking? Or, yeah, this drinking isn't really helping me so much. Maybe I should think about it more. That's called change talk. And there are different ways to elicit it and different ways you can listen for it. Okay, so that's your quick training on MI. So the shortest brief intervention that can be done is what's called the brief negotiated interview, which has 4 steps. And I'll quickly go over those for you. Again, it can be done in as few as 3 to 5 minutes if needed in a health setting or a counseling setting or a health promotion setting when you don't have much time. So first, you want to initiate rapport with your client. You want to thank them for coming in to talk with you. And you want to just to get to know them, what you would typically do in any conversation, and thank them for completing the screening. Okay, so remember, this brief intervention happens after the screening takes place. Step 2 is to basically give the feedback from the survey. So you want to give the feedback from the different screening tools that you deliver in a way that's very data-driven but conversational. So, you know, you ask students for their permission to share the screening feedback with them. And, you know, you always ask for permission with MI, and they typically will give it to you. And then you can say, based on US health standards, your drinking is above, you know, 95% of the population of students your age. What do you make of that? So you ask them then what they make of it. You ask them to, you know, do they agree with it? To try and you know, help them try and understand that and converse with them about it. You're not telling them to reduce their drinking, but you're just saying, compared to national data, this is where you fall. You know, what do you think of that? What do you make of it? Okay, so you present the feedback on each of the instruments. If the feedback falls in the low risk range, what you do here is you basically tell the student that their feedback is consistent with low risk, and you support the low risk behaviors that they say they're engaging in. All right, the next step is to support, to move forward with readiness, to enhance the readiness of the student. So that if the student needs to make a change to reduce their risk behavior, what you want to do is to promote the discrepancy, to develop discrepancy here. So, you know, how do the results from that survey that you took compare with what's happening with you? Well, the student may say, well, maybe I drink too much. So you ask, what are the good things about drinking? What are the not so good things? And then you want to say after that, what are some of the not so good things about making a change? And then lastly, what are some of the good things about maybe making a change? All right. And you want to end with the good things about making a change, because of the recency effect. The students will remember what, you know, what you want them to do, or what you desire that what you hope for them to do. So you want to do that to enhance readiness. The other tool you can do in a BNI, a brief negotiated interview, is to use what's called a readiness ruler. And you can do this with a physical ruler, or even just talk about it. So on a scale of 1 to 10, how important it is for you to make a change. So if a student says, well, a 7, you want to say something like, well, why not a 5? Okay, so if you pick then a lower number and say, why not a 5, you're asking the student to tell you change talk. They're going to be telling you why they want to change, and that's what you want to do. So you can do a ruler for importance for changing, and you want to also consider, and you can do a readiness ruler for confidence. How confident is the student in making a change, again on a 1 to 10 scale. This is a tool that works really well, and it's a really nice tool to end a BNI on. Lastly, we have negotiate a plan. Okay, so if a student falls within a low risk range in a brief intervention, that's easy. You can just say, keep on doing what you're doing. You know, let's talk about what you're going to continue to do. Okay, so they have a plan. If a student needs to be referred somewhere, referral to treatment, you can talk with them and work collaboratively with them about making a plan regarding a next step after you assess the fact that they're ready to do so from the step before. And you basically identify different options for them as next steps, and even if you can, do what's called a warm handoff. That is, help the student while they're with you, perhaps to make a contact to the counseling center or to an agency in the community, because the research shows that if you help a student making a warm handoff that way, they're more likely to follow through. Okay, and then referral to treatment. For students that need referral to treatment, here are some tips. Remember to always continue to use your MI techniques. Make it a conversation to understand and accept the possibility that the student may not be ready to have the warm handoff or to move to the referral, but you're planting a seed, and that's a really good thing. And also make sure you provide, if you can, more than one option, because the more students have a sense of choice and sense of agency in addressing their concerns, the more likely they are to follow up. All right, we are moving along here. So now we're going to be looking at some ways to deliver SBIRT and some variations that you may likely know about and some that you may not know about. There's no one way to deliver SBIRT. So let's examine some of the ones that are out there. All right, probably the one that's been around the most for college students is BASICS, the brief alcohol screening and intervention for college students. This was developed in the early 1990s by Alan Marlatt and his colleagues at the University of Washington. Currently, I'm sure that you all know Jason Kilmer. He's one that's really most active in working with and training on BASICS. He's a wonderful trainer in this technique, by the way, and we have worked together for over 20 years. And I always learn something new from him. So BASICS can be delivered in 1 or 2 sessions. It relies on motivational interviewing. The really good thing about BASICS is it's that it's been tested with the age population of the traditional college student, ages 17 to 24 or 25, based on the research that you're looking at in a particular time. And it, hands down, for alcohol use, has been associated with significant reductions in alcohol use and alcohol-related negative consequences across many, many studies, both in the short term and in the long term through longitudinal studies. So how does BASICS work? Again, it's an intervention that's 1 or 2 sessions long. And what happens is that students take a screening. Again, if it's BASICS, it's just alcohol use, but this can be adapted with fidelity to other types of drug use, cannabis use, mental health concerns, and the like. And then the student meets with a provider after taking the screenings to go over their personalized feedback profile. The personalized feedback profile for BASICS includes things like alcohol use compared to the other students on the campus, norms. There's a section on norms. There's a section on negative consequences. There's a section on protective behaviors. There are also sections in some personalized feedback profiles on the calories used when, based on the amount of drinking the student is doing per week, and the amount of hot dogs that's equivalent of eating. And, students think that that's kind of disgusting. And it's like, oh, no, I don't want to do that. And also some of the programs that support BASICS have in their personalized feedback profiles, they calculate the amount of money that a person spends based on the amount of drinking they do in a particular period of time. So what the provider does with a BASICS intervention is they go over the personalized feedback profile, a copy of which is given to the student, and they look for what's called a hook. Okay, using motivational interviewing, they look for what is moving this student toward behavior change. What are they most interested in about this feedback profile? They're not going to be interested in learning about everything in a feedback profile. It may be the calories, it may be the protective behaviors, it may be the negative consequences piece. So you want to look for that hook. What is the student getting excited about? And what can you use to elicit that change talk that we talked about a little while ago? All right, so that's BASICS. All right, so when, before the pandemic, many people were doing BASICS in person. That's where the research was done. That's where the data is, by and large. And that's what we were used to. We didn't really know that there was any other way to do this, though there have been a few studies with basics on online delivery and that type of thing. But the pandemic really turned our lives around, and we had to very, very quickly, even though there wasn't much data to support it, address ways of doing basics in particular, but even more so screening, brief intervention, and referral to treatment in new ways, primarily virtually and through other methods. And so what I'd like to do at this point is to show you some of the ways that we've learned to do screening, brief intervention, and referral to treatment, whether it's a basics type intervention that's a little longer, or even the few-minute type interventions, the anonymous interventions, in new and innovative ways that are working right now really, really well for us. All right. So let's talk about some anonymous screenings. There are a number of ways that we can do anonymous screenings, and these began to be very effective in the pandemic. We could do them online, through social media, through posters. Of course, we did it primarily virtually during the pandemic, but then we moved to flyers and signs and that type of thing. And, you know, SBIRT doesn't necessarily have to be done with a provider. It can be done anonymously, and there are programs out there. There are ways that you can set things up so that if a student scores but in a particular range in an online survey, you can use Qualtrics or whatever system you have on campus that can actually calculate the score and then take the student to another page on their computer or their smartphone or iPad to the feedback, and they can read the feedback, and it would tell them what the next steps are. So let me show you a little more about some of the ways that we did this during the pandemic. So here you see a bus shelter. So even though we were in the pandemic, students were still by and large living in their neighborhoods. They were still taking buses, but they weren't necessarily able to come in and meet with us face to face for an SBIRT intervention. So what we decided to do is to purchase space in our bus shelters and placed informational posters on tips toward reducing various types of risks in the poster sections of the bus shelters. So students, as they were waiting often a long time for their buses, they could read the poster. And I don't know if you can see, but at the bottom of the posters on these shelters, there's a QR code. So as the students were waiting for their bus, they could click on the QR code and take an audit if this was an alcohol poster here, or a QDIT if it was a cannabis poster. We had different posters on different shelters. And let me tell you that the first day that we put one of these posters out, we got 144 hits with screenings on this. And again, students were able to do a screen on their smartphone using the audit if it was alcohol use. And they would get, based on how they scored, personalized feedback as to their range of use and a recommendation as to what to do next. Okay. So, so this was really working well for us, and still is. We also became very active on social media. So this is a piece of an Instagram post. Take a free anonymous screening for alcohol. Okay, we did a series of Instagram posts for alcohol use, for cannabis use, and then later for gambling use. So, you know, you would make your Instagram posts, and they would be, of course, in a series that you swipe. And then on one of the areas that a student swipes to, there's a link to a screening for that particular issue. The student, again, could take the screening on their smartphone and get some personalized feedback right away. All right. Oh, here's just an example of the poster that was on the bus shelter. The slides got reversed, but anyway, here Here is another for cannabis. Okay. So again, these are all Instagram posts. Instagram was also very, very effective for us. And then here is something on gambling. Now, gambling and particularly sports betting is getting legalized across the country very, very quickly. What we're finding through a research study that we're doing is that gambling is your emerging issue right now. Okay. If there's something you want to keep an eye on, in addition to alcohol use, other drug use, and mental health, it is gambling. We just a couple of weeks ago, for over a month actually prior to that, did an anonymous well-being survey for our students and learned that over 47% of our students reported gambling in the last year. And we defined it, by the way. We didn't say it was gambling. We gave different examples, like using financial aid to bet on money, betting on horses, betting in the lottery. There's a whole different set of things. And over 47% of our students reported doing something in the last year. And the importance of looking at gambling is that there are a lot of consequences, particularly with students who use their financial aid dollars for doing this, because then they're not paying their bills. They are at risk of stopping out of school. A lot of negative things can happen. So again, keep an eye on this. And so we use the Southos gambling screen or the SOGS for gambling assessment. All right. So the other thing that we do to do what we call universal screenings or mass screenings is screening mass amounts of students in classrooms. So what we did to do this, and we're really successful in this, a lot of students are responding to this, is that for years we have been every spring going into classrooms. We've had our Office of Institutional Research select a stratified random sample of our students across different class years, across different schools on our campus, across classes based on time of day and day of week. So we would get the most representative sample of classrooms in our university. Then we would approach the professors and say, can we come into your classrooms to administer a 15-minute survey, a well-being survey? Essentially, what the well-being survey does in large part is does the screenings for us for alcohol use, for cannabis use, for gambling, for mental health. Okay. The surveys are anonymous. However, if at the end of the survey, if students are asked if they want to meet with a prevention navigator, that is somebody who essentially will do the brief intervention. We describe what a navigator is. And then if the students do want to do that, if they click yes, then the survey mechanism we have goes into a separate survey where students can list their name, email, and all, and we would follow up and make an appointment with them. And again, they're giving their permission, and the original survey data, the anonymous survey, stays anonymous. So, there are lots of magic things you can do with some of the survey tools that are out there. Okay, so again, anonymous survey in a classroom. So what do we actually do in the classroom? We put this slide up in the front of the classroom. Okay, this is not an active QR code. So if you click on it, you're not going to get anything. But this was the link to the survey we were administering up until last week. The students would sit at their desks. They would click on the QR code and they would complete the survey on their smartphone, laptop, or iPad. We got almost 100% of students who attended classes that day responding. So a good way to screen lots of students and also invite them if they want to do a follow-up brief intervention. Okay, peers. I'm sure a number of you work with peers, and probably some of you train them to engage in things like coaching, education, that type of thing. Peers, when thoroughly trained and supervised, you know, on an ongoing basis, not just one time and that's it, but on an ongoing basis, are actually able to learn motivational interviewing and are able to engage in SBIRT interventions. These students who are sitting at the table in front of you in the picture here have been have been trained in motivational interviewing under a new project we have called Project Access. Project Access stands for Achieving College Completion Through Engaged Support Services. We presented a webinar on this last semester. So we train undergraduate and graduate students with lived experience with substance use and mental health, as well as students who represent the rich diversity on our campus, to engage in SBIRT interventions, and to meet with students who want to have meetings to go over their well-being assessments, that is their screenings in the SBIRT process. We've gotten a lot of uptake from students, a lot of interest in doing this, and the satisfaction feedback that we've received are several things. First of all, what students are saying is they feel a lot more comfortable talking with peers than they do with professional staff. Peers are great feeders for professional services that already exist on campus. We're not duplicating those services, but we're helping students get there, and it's really working well. In addition to that, we've had really good results in terms of students getting and asking for information on services they can follow up with, whether it be counseling center, health center, career services. We know from the research, number one, that peers are very effective in delivering health information when they're well trained. Number two, we also know that that a lot of students who need services like health services and counseling services and career services and the like are the students who need them the most are the least likely to get there, and they're usually students with lots of health disparities. So you wanna help get them there, and that's what Project Access does. It helps students to get them to those agencies, and they are following through. So we're doing our little bit in order to get students to the services, because you know what happens at many colleges and universities, there's an orientation usually in the summer or fall before students start. They get tons of information. They probably forget most of it. And so what the Project Access intervention does, and the SBIRT intervention that goes with it, is that it provides the information in a just-in-time manner, in a timely manner, and in a responsive manner. So that is what we do with that. And then to leave some time for questions and to conclude this presentation, I want to leave you with the message that SBIRT works. The conversations work. It works in reducing risk behaviors. It helps work in helping students change and increase their protective behaviors. And it's really, I think, a win-win, and that's what we want to get to. We want to get to the win-win, and also leave you with the fact that SBIRT does not necessarily have to be done in one way. It can be done within a few minutes. It can be done by a variety of different providers. It can be done virtually. It can be done totally hands-off if you need to do it that way, and if you don't have the staffing capacity to do it in other ways. And what are you doing? What are we doing? We are supporting the health and well-being of our entire campus community in that regard. So with that, before I end, I want to say this is more for your use. I'm going to share these slides, but these are SBIRT. These are slides where you can actually look at examples of a good and a bad MI type SBIRT intervention. They're really very interesting. I highly recommend that you look at these. They were developed by Miller and Rolnick's group, who are the gurus of motivational interviewing. And also, by the way, there is a fourth volume of the MI book out, And I'm happy to report to you that it's very much social justice focused. A lot of the terminology that I mentioned to you here is being changed. Lots of, terms around empowerment, that type of thing. It'll be very much social justice focused. So, I think you'll really enjoy reading it, and you'll be very happy to see how the work has really advanced to support social justice. So, which I'm a big supporter of. So here's my contact info. Annabelle, I'm going to pass it on to you. I don't know how you want to do questions. As you know, with my visual impairment, I can't really read
Right.
the thing. But anyway, and let me try and see if I can I'm going to close out this and try and get myself on the screen so people can see. I'm going to unshare.
All
I
right.
can see
Yeah,
how to do that.
so for any folks that have questions, you are welcome here to unmute and ask questions or put them in the chat. So I am looking at the chat now. And thank you, Dolores, for that presentation, giving us more of that, insider look on SBIRT, as it helps a lot as well.
You're welcome.
And just for those of you who have not been on the chat yet, I had mentioned that Jason Kilmer will be at our state conference in April. He's going to give a pre-conference on selecting effective evidence-based strategies, and then doing a keynote as well. So we're happy to have him on board. We're also having Dave Clausen with us, and then Jen Jacobson from Macalester College in Minnesota. So got a few other people that'll be there, but those are the main keynotes. Does anybody have questions or comments at this time? Because I know Nikki had commented earlier, just saying that they were learning from you guys' campaign at University of Albany to do their own kind of restroom messages and bus shelter apps.
Thank you. Is anyone in the group doing SBIRT already?
I think Illinois State is, as far as I know. Heard too much else. I think a few of our institutions use them, but they're not on the call. So
Right. That's wonderful. I totally endorse SBIRT. I love the intervention. It's, it's evidence-based. It also can be done, of course, in a culturally sensitive manner. That's really important right now.
right. Yeah, so it looks like Jamie, she's a member on our advisory board. She does like SBIRT on their campus.
Mm-hmm.
Yeah, well, if anybody else, if you guys have questions, you can always email me, and I can always get you guys in touch with Dolores or vice versa. But we're, thankful to have you guys here and just to learn about some work going on in the prevention field. So we will be in touch, and I will send some follow-up information. But otherwise, thank you, Dolores, for your time today and sharing all the information. Let's see.
Great. Yeah, thank you so much. And anyone who's interested in any information that I provided or has any questions, please feel free to follow up with me offline. I'm going to share the slides with Annabelle, so you'll get those as well.
Sounds good. And the slides and the webinar will also be posted on the IHEC page. So in case you want to share this, say with your administrators or your colleagues, you'll be more than happy to do so. So, all right. Well, thank you so much, everyone, and have a wonderful rest of your afternoon.
Thank you.
You're welcome.